what are we dealing with tick diseases? Dr. Wade talked about Lyme disease as being something that everybody hears about, but there are other tick diseases that we see in the horse. Primarily what we see in the horse is anaplasmosis. It is a disease that we see very commonly. When I first got out of school, never saw it. Probably 3 or 4 years into graduation, working out there in the field, started seeing horses with low-grade fever, inappetence, and not much more than that. Things have progressed, however, with anaplasmosis, and now we're seeing some additional symptoms. I think the bug is changing some. It comes along with sometimes some limb swelling. Secondary laminitis, another reason for them to get sore feet. Sometimes we'll see some soft stool. So how do we make the diagnosis? Primarily we do it, a lot of times, we get to see the horse, it has inappetence as a fever. Well, it's almost like they have a tetracycline deficiency right then. Primarily we make the preliminary diagnosis of anaplasmosis just based on that clinical sign because, yeah, we see it so commonly. But we can take some blood and do a blood smear. There's a couple other tests that we can do, but what we're looking for is an inclusion body. That's a neutrophil, or a white blood cell in the horse. And that little purple dot where the arrow is shining toward is actually where the bacteria is residing inside that white blood cell. Here's a thing that you might be aware of if you take your dog to the veterinarian and they do a 4DX test. That test tests for Lyme, it tests for anaplasmosis, it tests for Ehrlichia canis. Anaplasmosis is another, we used to call it Ehrlichia equine, and that's when people say, my horse has Ehrlichia. Now some microbiologists sat back in a room and they changed the name to anaplasmosis so they could secure a job, I guess. So anaplasmosis treatment is pretty standard. We give IV tetracycline. We used to only give it for a couple or 3 days. We've been seeing some relapses. Now we go to 5 days. Again, I think the bug is changing, getting harder to treat. So the IV part of this requires veterinary administration, which, yeah, we're expensive, so there's a little more expense there. And you should be aware that occasionally we have seen some relapses. So the tick life cycle, it's actually a 2-year, ticks are an amazing organism. It's a 2-year life cycle. They're born, eggs are hatched in the spring, larvae develop over that. But you can see, so starting in the center of the circle there, the eggs are here and they hatch and they form larvae. And the reason that the Lyme or anaplasma survive in the environment is in this little guy, primarily, the white-footed mouse. And so these larvae are feeding on these mice, and they get a blood meal there, and they get a chance to infect the mice and keep them all infected, and then refeed, and it just goes from there to all the feeding on us, horses, dogs, cats, and we just go right along and become hosts for Lyme and anaplasma. So here's the Ixodes tick. This is primarily the disease causer in our area. There are other ticks out there, Dermacentor ticks, the dog tick. It's generally not horse disease related problem. Could have some other more exotic tick diseases from the other ticks. So here's that white-footed mouse that you might see as you're going through the woods or in the underbrush. These are the little buggers that really keep the Lyme and the anaplasma alive. So one of our control methods is also to control these guys. The white-footed mouse, actually one of the primary predators for a white-footed mouse is a fox. So if you have fox, you're going to have decreased numbers of white-footed mouse. But what's happened in our location is the coyotes have taken over, and that's displacing the fox. Therefore, the coyotes don't eat as many mice. They go after larger prey. So the mice are surviving better because there's less fox, more coyotes. So this is the tick hanging there, just waiting for you or a horse to go by. They hang there, and all of a sudden, when they feel heat or CO2, they start waving these arms, trying to grab on. So let's talk about habitat. Where do you think a tick would be better? The picture on the left is a pasture with low grass, not much trees, or as the picture on the right would be. And so there's very likely to be very few ticks out here for a couple reasons. One is the white-footed mouse probably isn't going to live in an area like this, but they'll live in areas like this. So when we're worried about tick diseases, probably if we have pastures like this, we won't have as much to worry about as if we have a pasture like this. You saw the other pictures, but the humans get anaplasmosis as well as Lyme, and so it's right next to the Lyme disease, the same. We don't report our equine diseases to a state agency, so there's no tracking of that necessarily, but these are the human cases that are found. And the horses go right along with it. One of the problems with both Lyme and anaplasmosis is you can see that it's regional. So companies like Merck, the company that sponsored the meeting, they look at this map too. Where's their market for any product that's going to help against anaplasmosis or prevent ticks? Well, for the majority of the country, they don't deal with this issue. But we just happen to be lucky enough to be in this region, and there's not much pharmaceutical help because of the market. So what's happening with the incidence rate? These again are the human cases, and this is just Wisconsin data, 1990 to 2011. We can see cases per incidence per 100,000 people, kind of cruises along, and we get into the last couple of years and look what's happening. So,
more cases or better finding or more aware?
I believe it's more cases, actually. I think there's been enough work even in these early years